Welcome back. Missouri voters are in the middle of a Medicaid expansion tug of war. Pro-expansion and those against it are ramping up their messages, appealing to voters as the August 4th election gets closer.
41 Action News anchor Cynthia Newsom reports opposing sides do agree the Medicaid expansion proposal is a defining moment for Missouri.
Money is a key hot-button issue in the debate over the proposed constitutional amendment to expand Medicaid in Missouri. There is no argument the federal match for Medicaid would jump from 65% to 90%. That's more than a $1 billion a year windfall for Missouri. And Missouri's Medicaid cost would drop from 35% to 10%. So the Missouri Foundation for Health calls Medicaid expansion a win.
It's funded by bringing tax dollars we've already paid back to Missouri. Medicaid expansion for Missouri just makes sense.
But it doesn't make sense to Missouri State Senator Bob Onder, who is also a practicing physician.
The average state that has expanded Medicaid under Obamacare has seen about 156% overrun in their original estimates. And that's likely to be even worse in Missouri right now with the state of the economy.
An economy rocked by the coronavirus. 500,000 Missourians filed for unemployment since the COVID-19 outbreak. The Vote Yes on 2 Healthcare for Missouri campaign is endorsed by more than 200 medical, business, labor, and nonprofit organizations. They countered claims of cost overruns by quoting from a 2019 Washington University study.
What it showed was by the year 2024 in Missouri, if we can expand Medicaid by approving Amendment 2, it'll save us $932 million. Those are savings that, quite frankly, in this economy and in this environment are needed more now than ever.
Already, Governor Parson has had to do withholds, cut items out of the state budget twice this year. And it's going to get even worse if we do the fiscally irresponsible thing and expand a program that's already accounts for 1/3 of our budget in Missouri.
Right now, single adults do not qualify for Medicaid in Missouri, and a family of 4 has to earn less than $5,500 a year to qualify. Medicaid expansion would mean single adults earning up to $18,000 a year would be eligible. An estimated 230,000 Missourians would qualify for Medicaid if expansion is approved. Now, supporters also claim it could create 16,000 jobs in Missouri. But Governor Parson has a question for voters.
Can you really afford it? What do you want to give up? Because that 175 or the 250 million or 300 million, whatever it's going to be, will have to come from other programs.
If voters approve Medicaid expansion, Governor Parson said it's possible budgets for education and roads and bridges would have to be cut to make sure Medicaid expansion is fully funded. Cynthia Newsom, 41 Action News.
This Kaiser Family Foundation map shows 38 states and Washington, D.C. have adopted Medicaid expansion. The Missouri State Chamber of Commerce and labor unions, they want Missouri to be number 39.